Family planning has been widely accepted by a lot of couples throughout the world as we see them employing modern means of contraception to either space or limit the number of children that they want to have. However, the Catholic Church still maintains her stance on this issue. This is Catholic Faith Forum. I am Nonso Igwe, and I welcome you to another beautiful episode. Don't go anywhere. When we come back from this short break, we'll meet our guests and dive right into our discussion. Stay with us. Welcome back. This is Catholic Faith Forum. Like I said earlier, we're talking about contraception and modern means of contraception. But today we'll be talking about one interesting one that a lot of people have not really known. And joining my discussion today is Dr. Tubal Adeogun. He's been here before, and this is not his first time being on the show with us. You're welcome, Doctor.
Thanks for having me.
How do you feel being here one more time?
I feel great. Thank you for inviting me again.
You're welcome.
Thanks.
So today we'll be talking about tubal ligation. That's very heavy. I know that when I first heard about this topic, I thought to myself, what is tubal ligation? See that it's rolling my tongue again. Tubal ligation about. What is tubal ligation about? Let me ask you this question.
Okay, thank you very much. Tubal ligation, like the name implies, refers to a surgical procedure whereby the fallopian tubes in a woman are tied up, in quotes, or clipped so as to prevent pregnancy. Usually, tubal ligation is a procedure that is planned. Before it is done, of course, the patient or whoever would go for it is already well notified about what the procedure is about and what the aim of the procedure is. So basically, it's a form of tubal sterilization because usually a matured egg is released from the ovaries and it has to travel through the path of the fallopian tube, you know, to where it can get fertilized. But when that pathway is disrupted, you know, pregnancy cannot be achieved. So that is the whole essence of the mechanism of contraception provided by tubal ligation. So it can be bilateral. So you call it bilateral tubal ligation. That means the two fallopian tubes are actually tied.
Okay, now you mentioned something very interesting. The two tubes, meaning that if they close just one, there's still a possibility of pregnancy happening. Am I correct?
Absolutely.
So what are the implications of actually undergoing this procedure?
Well, the implication is first and foremost knowing that when you do that, that's almost like a permanent form of sterilization, and that the person is going in there knowing that they may not be able to conceive, or the likelihood of them conceiving is actually slim. Though even after the procedure is being done, there's still a 0.5% failure rate. So that means that some people still get pregnant, but it may now be ectopic pregnancy, whereby the egg is fertilized outside of the womb and it's not going to get implanted where it should be, and that can be life-threatening. Yeah, so
you've mentioned a few risks. What are some other risks involved in this procedure?
Okay, just like every procedure has its upside and downside. But when the advantage, you know, outweighs the risk, then we ask the person to go for it. So in bilateral tubal ligation, you have, like I said, it's a surgical procedure. So first and foremost, the risk factors includes damage to some important organs like the bladder, like the bowels, and then even some important blood vessels. And then you may also have the risk of reacting adversely to the anesthesia that is given prior to the surgery. And then you may also have infections and poor wound healing. That's also a possibility. And then there may also be recurrent abdominal pains after the procedure, you know, that just keeps coming, you know, intermittently off and on. And then in some people, like we said, the failure rate, you know, of the procedure itself. So they can have ectopic pregnancy. And when ectopic pregnancy occurs, the person is actually pregnant but the implantation is not in the proper place. And then when the fertilized egg starts growing where it is, when it starts developing, gets to a point where it cannot accommodate, where the tubes where the implantation occurs cannot accommodate the developing fetus, and then there's a rupture, and then there's an internal bleeding, and, you know, blood pressure crashes, bloody, and then it can lead to death, because it's something that can be missed very easily. Because if that slim chance that we said of failure occurs, the high likelihood of ectopic pregnancy is a high possibility.
But you still, like, you've mentioned all these things, and I can imagine that as a doctor, would you tell your patient or whoever comes to you and say, oh, I'm trying to opt for this? Do you let them know of these risks?
Absolutely. That's the ideal thing to do. Because before you go through any major procedure or any surgery, there is a counseling aspect, and then there is the consent aspect. You know, it's ethical for you to make sure that the patient, you know, knows absolutely the risk involved, details of the procedure, and then, you know, all the likely risk or problems that may arise or complications that may arise from the surgery, so that they can make an informed decision. Because if you give somebody half information, it's not going to be helpful. The person needs to know exactly what they are going into and let them make a choice for themselves if that's what they truly want.
Now, I'm moving to something else, talking about letting the person know about the risks involved. Now, what about spousal consent? How important is this, especially when someone is trying to undergo this procedure?
Spousal consent is a very important aspect, because it takes two to make a family.
Exactly.
And then when you have children and you think, well, we've had enough children, or we want to space out our children. But in this case, this is not the regular contraception, because this is more like a permanent sterilization. So it is even more important that the spouse is carried along.
Exactly.
So they should both ideally come for counseling, and then it's not something it's not a decision they should rush. They should go think over it and make a decision amongst themselves if that is what they truly want, after going through all these risk factors and all the potential complications that may arise from the procedure. So spousal consent is important.
Very important, yeah. But have you had cases whereby maybe one party doesn't agree to the procedure and the other person is in for it? How do you go about this?
Okay, well, in real life, I won't say I've had that personal experience, but if that should arise, I would think that it's best, at least in Africa, where you know, the family units and the
the family exactly
is so closely knit. You will tell them, you need to go think over this, and you need to make a decision if this is what you truly want. Because we're not just going to tell the woman, okay, you feel that's good enough for you, then go for the procedure. We would still need the husband to give consent, because somebody may sue you for doing something like that to his wife without his knowledge.
Exactly.
You know? So, but in other climes where you know, women make decisions for themselves, anything regarding their reproductive health or their bodies, well, you know, laws are different.
Yeah, in different states,
parts of the world. So in such a case, maybe the woman can make a decision for herself without anything coming up.
Okay, thank you so much. Hold that thought there. We have to go on this very short break. When we come back, we'll continue with our discussion. Stay with us. Welcome back. This is still Catholic Faith Firm, and I am Nonso, and together with Dr. Dami, we're discussing tubal ligation and what the church says about it. So now, moving on, since we're talking about people and then spousal consent, I'm now thinking to myself that one thing that the Catholic Church has always stood for is freedom. Freedom of expression, freedom to express your faith, to believe, and to express yourself within the community, the body of Christ. So then, don't you think that this translates even down to the person who wants to have this procedure? Do we say that they have the freedom to actually do this?
Well, the truth is, you have people of different faith all around the world. And, you know, first and foremost, in medical ethics, there's something called patient autonomy, where a patient decides what is best for them. So all the doctor or the health professional can do is to give health advice and then tell them, okay, this is the guidance you need. These are your options. These are the things that will be in your best interest. But it's still absolutely left for the patient to make a decision for themselves. So when it comes to faith, well, yeah, a lot of people, because of how they hold their faith, you know, may have questions arising relating to these issues. But it is still absolutely up to them to decide how they want to balance things out. Because, you know, when it comes to your body or whatever your health condition is, all the health professional can do is to give you guidance. For instance, nobody forces a pill down your throat. They can only tell you this is good for you. They can only try to advise you, use your medications, you know, be compliant with drugs, exercise and all that. But nobody would actually compel you to do anything. So it still lies in your court to make a decision. Okay,
but I think that a lot of people are actually missing this, because as much as the church stands for freedom, I also know that the church also stands for human life. the dignity of human life. And if you're doing anything that ordinarily is bad for your body, I mean, can be bad for your body, has some risk factors involved, I don't think that the freedom then speaks here again, especially when we're talking about, oh, dignify yourself as a human being, do things that would make you, I mean, live well, be well, generally. So now I want to ask you, what's your own stance on birth control and contraceptive generally?
Well, generally, when it comes to contraception, it's still a big issue of discourse.
Exactly.
And, you know, different people have different points of view regarding this. Like you rightly said, when it comes to issues of faith, yes, God expects us to take care of our bodies. God expects us to be very careful with things we do with our bodies, because our bodies are a temple of the Holy Spirit.
Exactly.
And then we should make sure that anything that puts us at risk or potential causes of harm for our bodies should be avoided as much as possible. But on the other hand, looking at family spacing and birth control is also a big societal issue, because in some cultures, people have many children, more than what they can care for. And that is one of the societal ills we have today, because a lot of people, you know, have kids that they can't send to school, have kids that they can't give the best of amenities to. And at the end of the day, these kids become something else in society. So I think when it comes to contraception, it's a very wide scope. And like you know, there are other methods of contraception aside the bilateral tubal ligation we're talking about. And they also pose their health risks too. So I think working with the natural contraceptive methods, you know, people really knowing about that and being enlightened or having more health education, reproductive health education about these things will go a long way to advise people properly on how best to control the size of their families.
So is thinking about spacing and then the number of children to have, as a doctor now, is it about not taking care of the children, or having too many children is bad for your body?
Okay, well, having too many children can put you at some risk, because, for instance, there's something called uterine atony. The number of children you have, you know, the number of pregnancies you have carried would, in simple terms, make your uterus, that's the womb, the muscle of the womb, a bit slack.
Okay.
And then you need adequate contraction to stop bleeding after birth. So people that have 8 children, 7 children, by the time they are having the 8th child or the 9th child, after delivery, you may have postpartum hemorrhage, and that is very life-threatening to the mother. So what is the point of you having 9 children and having to die on the 9th delivery and leaving 9 children, 8 children and an infant, and dying? I think, you know, it's a problem. So really, it's really a major source of concern that people should be able to know all these things and then be able to make good decisions or wise decisions regarding the size of their family, because children are gifts from God. We agree with that. But when you have too many of them, it poses a risk factor. And then another thing is that there are some pregnancy-induced conditions that normally women would not have if they were not pregnant. So, like hypertension, there's pregnancy-induced hypertension, there's gestational diabetes.
Wow.
And then there can be some difficult deliveries too. You know, you can have retained placenta. There are many things that can put a woman's life at risk associated with pregnancy and delivery. So the more deliveries or the more pregnancies they have, the higher the chances of these things. So there's a possibility of these things happening when they have large number of pregnancies. So it's best they make a wise decision on spacing their family.
And I know that the church, now let's talk about the church stance on contraceptives. What do you think the church stands for when it comes to spacing and giving birth to children?
Well, I think the church stands for the biblical injunction that says that go into the world, be fruitful and multiply, and replenish the earth and all that. Yeah, I know that. But all the same, they frown on anything that has to do with you modifying your body in any way, you know, which to a very large extent makes sense. But also, on the other hand, like we have said, it is still wisdom to be able to know that just because I'm fertile doesn't mean I should have 40 children.
Yeah.
For instance, you know, so you still need to bring other factors into play to make an informed decision on what you want. I think it boils down to the level of awareness of the parents, and it also boils down to what they want for themselves and the quality of life they want for themselves and their children.
Yeah, and I don't think that the church's concern is not about spacing. The concern is most of these things that you actually do to make yourself, to limit the number of children you have, might cause you harm to your body.
Absolutely.
So that's what the church is trying to be against. Okay, so if you cannot do this, just stick with the natural planning. Now, back to natural planning. I know that every time we talk about contraceptives and birth control, we always say natural planning here, natural planning that. What is natural planning, in fact?
Well, natural planning is just natural planning.
Literally.
And it's just, you know, a woman understanding her body, understanding what her cycles are like, and then knowing when is her fertile period, knowing when she ovulates, and then, you know, knowing that, okay, this is my safe period, this period I'm not safe. So, you know, with that and the frequency of intercourse around that period, you know, is something that can be worked amongst couples. So natural planning just entails you knowing when you're fertile and knowing that you should avoid intercourse within that period.
I like that. Thank you so much for that. We're not going anywhere until we learn a little about our saint for the week. Our saint for today is Saint Gianna. Stay with us and learn some more.
Today we are talking about Saint Gianna. Saint Gianna was born in northern Italy near Milan. Her family was devout, and Gianna learned the value of prayer and Christian service very early. At age 12, she became involved in Catholic action, and as a young adult, she joined the Society of St. Vincent de Paul. Gianna began studying medicine during World War II and afterward became a doctor specializing in pediatrics. After marrying Pietro Molla in 1955, they had a son and 2 daughters. While pregnant with her 4th child, Gianna was diagnosed with a uterine tumor. She resolved to save the life of her unborn child despite the risk to her own life. Her 4th child, Gianna Emanuela, was born on April 21, 1962, and Gianna died 7 days later as a result of complications of the tumor. In his homily on the occasion of her beatification on April 24, 1994, Pope St. John Paul II offered Gianna Beretta Molla as a model for all mothers. By holding up this woman as an exemplar of Christian perfection, we would like to extol all those high-spirited mothers of families who give themselves completely to their family, who suffer in giving birth, who are prepared for every labor and every kind of sacrifice, so that the best they have can be given to others. Gianna was canonized on May 16, 2004. Saint Gianna understood the realities of being a wife, a doctor, and a working mother. She believed deeply in the holiness of the family and in the sanctity of human life. It was this deep belief that gave her the courage to entrust herself and her family to God's loving hands.
Welcome back. This is still Catholic Faith Forum. Thank you so much, Chima, for that. As we're saying, we're talking about natural family planning. So my other question is, you were talking about regular, when you see your cycle, but we know that some women don't have regular cycles. So, and this will affect them. What do you think that, okay, for the other side of the coin, the women that don't have regular cycles, how would they do this natural planning?
Well, like I would say, if you don't have regular cycles, that is not normal.
Okay.
So usually when people don't have regular cycles, they should seek help. Go to see a gynecologist and find out why that is the case. Sometimes it may arise from hormonal imbalances. Sometimes it could be just that the woman is stressed out. Sometimes it could also be that some other things are silently happening, like a thyroid dysfunction.
Okay.
You know, that may be silent, and that may be sometimes the only presenting feature. So that is where health checks, frequent health checks come into play. when you go to your gynecologist or your GP, you tell them, oh, I'm not pregnant, but I can't see my period. What's going on? You know, they will order for some tests, have you do some scans, check the ovaries, is something happening, are the hormones within normal limits? And if something is wrong, they help to treat you and bring you back to normal so that you can predict correctly, because you don't want a situation where, you know, you are in the dark, you cannot plan, and anything can result from that. So it's a good platform for us to talk about regular health checks.
Yeah, thank you so much. So now my final question would be, are there other procedures one can take apart from that the church will agree with?
Well, most of the other contraception methods, you know, we have a chain of them. There's so much. You have your injectables, you have your patches, you have your pills, you have emergency contraception, and then you also have the barrier methods. You know, you have the barrier.
I'd like us to talk about that some other time.
The barrier methods, you know, both for male and female. You know, yeah.
Okay.
So they exist, and use of spermicide gels, use of diaphragms, use of the coil, the copper T, and all that. All those are other methods that are available, but they still come with, most of them still come with their risk factors.
Risk factors, okay.
Yeah, infections, you know, the copper T being dislodged, you know, from its original position and all that. So overall, I would say that the natural planning is still the safest with absolutely zero effects, adverse effects, so to say.
Thank you so much for being here. I really appreciate, and I'm sure that our audience out there, they really appreciate you being here today to actually tell us what Tubal Ligation is all about. So we're not done with the show until we meet with Collins with Know Your Faith. Stay with us.
Hello and welcome to another episode of Know Your Faith series. I'm Collins, and on today's episode, we'll be talking about one of the most popular prayers that we should know as Catholics, which is the Angelus. Now, we'll be focusing here on the origin and when to pray it. So the Angelus, which was designed to commemorate the mystery of the Incarnation and pay homage to Mary's role in salvation's history, has long been part of our Catholic life around the world. It is said 3 times every day. The faithful stop whatever they are doing, you know, and say the words, "The angel of the Lord declared unto Mary," you know, beginning the simple yet beautiful prayer. But why do we say the Angelus at all, much less 3 times a day? So, first we should remember that it was called by the bell. Now, most church historians agree that the Angelus can be traced back to the 11th century in Italy, where monks said 3 Hail Marys during night prayers at the last bell of the day. Over time, pastors encouraged their Catholic flocks to end each day in a similar fashion by saying 3 Hail Marys. Now, in the villages, as in the monasteries, a bell was rung at the close of the day, reminding the laity of this special prayer time. The evening devotion practice soon spread to other parts of the Christendom, including England. Now, towards the end of the 11th century, the Normans invaded and occupied England in order to ensure control of the populace. The Normans rang a curfew bell at the end of each day, reminding the locals to extinguish all fires, get off the street, and retire to their homes. While not indeed intended for it to encourage prayer, this bell became associated nevertheless with evening prayer time, which included saying the Hail Mary. Now, once the curfew requirement ended, a bell continued to be rung at the close of each day, and the term curfew bell was widely popular, although in some areas it was known as the Ave or the Gabriel bell. Now, around 1323, the Bishop of Winchester, England, and future Archbishop of Canterbury, Bishop John de Strafford, encouraged those of his diocese to pray the Hail Mary in the evening, writing, in quotes, "We exhort you every day when you hear 3 short interrupted peals of the bell at the beginning of the curfew, or in places where you do not hear it at Vesper time or nightfall. You say with all possible devotions, kneeling wherever you may be, the angelic salutations 3 times at each peal, so as to say it 9 times in all." Now, this is gotten from the publication of the Catholic Societies in 1895. Meanwhile, around 1318 in Italy, Catholics began saying the Hail Mary upon rising in the morning. So likely this habit again came from the monks, who included the Hail Mary in the prayers they said before their work day began. The morning devotion spread, and evidence is found in England that in 1399, Archbishop Thomas Arundel ordered church bells to be rung at sunrise throughout the country, and he asked the laity to recite 5 Our Fathers and 7 Hail Marys every morning. Now, the noontime Angelus devotion seems to have derived from the long-standing practice of praying and meditating on our Lord's Passion at midday each Friday. In 1456, Pope Callistus III directed the ringing of church bells every day at noon, and that Catholics pray 3 Hail Marys. The Pope solicited the faithful to use the noonday prayer to pray for peace in the face of the 15th century invasion of Europe by the Turks. The bell rung at noontime became known as the Peace Bell or Turkish Bell. Now, in 1481, Pope Sixtus IV was petitioned by Queen Elizabeth of England, the wife of King Henry VII, to grant indulgences for those who said at least 1 Hail Mary at 6 a.m., noon, and 6 p.m. There is evidence that a bell was rung at those times. Now, the Angelus today. By the end of the 16th century, the Angelus had become the prayer that we know today. 3 Hail Marys with short verses in between called the versicles, ending with a prayer. It was first published in modern form in a catechism around 1560 in Venice. This devotion reminds us of Angel Gabriel's annunciation to Mary, Mary's fiat, the Incarnation, and our Lord's Passion and Resurrection. It is repeated as a holy invitation, calling us to prayer and meditation. For centuries, the Angelus was always said while kneeling, but Pope Benedict XIV, from around 1740 to 1758, directed that the Angelus should be recited while standing on Saturday evenings and all day on Sunday. He also directed that the Regina Coeli, Queen of Heaven, be said instead of the Angelus during the Easter season. Now, over the years, many of the faithful have focused the morning Angelus on the Resurrection, the noon Angelus on the Passion, and the evening Angelus on the Incarnation. Now, as we all know, there's something common, which is the ringing of the bell. So this is a significant part of the traditional devotion, and it's not only the ringing of the bell to just announce the time of prayer, but the manner in which the bell is rung. The ringing consists of 3 strokes of the bell, each followed by a pause, and then 9 strokes. John Sullivan, in his 1917 book, said that the externals of the Catholic Church writes, "The manner of ringing the Angelus seems to have varied little since the beginning of the devotion. Old monastic records, going back to the 15th century, show that the bell ringer was directed to toll the Ave bell 9 strokes at 3 times, keeping the space of 1 pater and the Ave between each of the 3 trollings." Now, I hope that you've been able to really understand the history behind the Angelus. I mean, these are prayers that we say every day, but sometimes it's just really good to take time, reflect, and actually understand how they came to be. So when someone actually walks up to you and asks, you'd be able to reply them. So that's it for today, guys. Please, you can write whatever you've learned, whatever was peculiar to you in the comment section. Feel free to share and subscribe to our YouTube channel at Dominican Media Presents. And until I come your way next time, be bold and be Catholic.
Welcome back. Thank you so much for sticking with us to the end of the show. For your sponsorship, simply call us with the number shown on your screen, or you can send an email to us on the email shown on your screen as well. And you know that you can watch this episode and other episodes on our YouTube channel at Dominican Media Present. Also, send us your questions and your suggestions on our social media handles at CFF on TV across all platforms. Till I come your way next time, keep being saints in jeans and shirts.